So the other thing, Dr. Harrison, the one thing that we see, in that when baby cries, that is a very painful moment for the mom, and sometimes they don't even know what to do.
Yes.
Any thoughts or suggestions, when baby cry, how to console the baby in that moment?
Yes, well, that reminds me of another story of the lady health workers. What we teach in the training to the lady health workers is that there are many ways to help a baby, to console a baby who is crying. And it is a really good idea to start out with the least intrusive or the least active methods of consoling a baby first, because then you're giving the baby an opportunity to practice their own self-comforting. And that's a wonderful capacity to have. So the first thing you could do is to show the baby your face and then to talk to the baby and see if the baby can use your face and voice to calm herself. And then after that, you can bring the baby's little arms close to the midline and gently press them on her chest, because sometimes newborns and young babies have a hard time controlling their upper extremities, and that can be dysregulating to them. And then after that, you can place your hand gently on their chest or abdomen and give them a little bit of gentle, deep pressure, which can often calm a baby. And after that, you can pick up the baby. I'm not sure I'm remembering all of the different comforting methods, but these are some of them, and you get the idea that they're progressive. You become more active in your comforting as you try one, and if that doesn't work, you try the second, and if that doesn't work, you try another one. And then what you can do then is you pick the baby up and comfort the baby physically that way. And if that doesn't work, you can walk with the baby, rock the baby. If that doesn't work, you can swaddle the baby to bring the baby a sense of comfort and containment. And if that finally doesn't work, you can give the baby something to suck. Maybe not a nipple with milk, but something else like a pacifier or whatever you have, your finger even, if it's the mother or the relative. But what you want to give the parent, the mother, is the idea that there is a whole repertoire of different ways to comfort a baby. She doesn't have to immediately go to feeding the baby, because if you start slowly, you invite the baby to try to comfort himself. And that is building the baby's capacity for self-regulation, which is a very important capacity.
Wow, no, thank you so much. I think those are very good step-by-step approach to how to calm or soothe the baby.